I can't tell you how many our behavior analyst will recommend to a parent that they come in for a speech evaluation, and every parent says, well, they talk okay. And so it's really nice to understand that language is such a huge part, and that really is a point. Behavior, ABA, can target a lot of that early developing speech. They can do a lot, and they do a lot of that early developing language, which is really fun for me. And I've learned a ton working with them to be able to know how to target that early developing speech. But when we get, or language, but when we get to those more complex languages, ABA falls out of the picture. They don't have the ability to recognize those differences in receptive and expressive language delays. Overall, with language therapy, I like to think of language therapy as just how our brain organizes what we say, what we think, how we understand. So speech therapy targets that. It helps people to be able to create a network of understanding in their minds. So we split that up in two different ways. We split it up between expressive language and receptive language. So expressive language is how we're using words and body language and everything to be able to express our thoughts and wants and needs and feelings. Receptive language is how much we're comprehending, how much we understand. Two of the biggest things that I see with expressive language, they have a really hard time telling stories. They have a really hard time saying what their wants and needs are. When they're little, they may not have any words. That's an expressive language issue. When they're older, they may have a hard time telling stories. That's an expressive language issue. When we come to receptive language is understanding. So with my older kids, I see they have a really hard time following directions. It's really tricky for them. With my younger kids receptively, they have a harder time answering where questions and who questions and what questions. Those are really tricky for them because they don't understand what the question meant. So you'll say, who do you see? Who do you see when you're sick? And they'll say hospital, right? They don't understand that the who part actually had a lot of meaning in it. They answer a where question because where is one of our earliest developing WH questions. So they have a hard time kind of teasing those apart. So that's some of the things that we work on. We'll work on their ability to understand and comprehend, and then we'll also work on their ability to express. I think the biggest thing that I see, and this happens all the time, especially with our older kids, is that their receptive ability is quite high. They're able to understand those WH questions. They're able to understand what people are telling them, but they have a major deficit in their expressive language. And so people generally tend to overlook them because they understood what the task was. They understood that they needed to go upstairs and find their shoes and put them on, grab their jacket and come downstairs. And so parents say, they're fine. They don't have a language disorder, but expressively, it's very, very difficult for them to be able to tell you what they want and what they think. And so with our older kids with autism, if they didn't show frustrations when they were younger, they start to really show frustrations as they get older because they're understanding everything, but they're having a very, very difficult time expressing what they think and what they want.